back. This is Boomer Life on CL 650.
Welcome back to the program. Sterling Fox with you, joined on the line by Dr. William Yee. Dr. Yee is the Medical Imaging Director of False Creek Healthcare Center, downtown at 555 West 8th Avenue. Okay, it's not right down at Georgia and Granville, but come on, everybody knows where West 8th Avenue is. Dr. Yee, this is Brain Awareness Month, this Brain Injury Awareness Month, this month of March, and we've been talking a lot about the amazing equipment that you have at your disposal at False Creek Healthcare Center. But talk to us a little bit about the specifics of brain injuries. What's the difference, for example, if any, Dr. Yee, between a brain injury and a concussion? Or are they, in fact, one and the same thing?
Well, the most common and least serious type of brain injury is called a concussion. And it comes from the Latin word concutere, which means to shake violently. And there are different types of concussion. But once you've had your brain rattled, what are the signs of a concussion? Well, you may feel a little confused, or you may feel dazed. You may feel a little clumsy. You may have slurred speech, nausea or vomiting, or a headache. You may experience blurred vision or sensitivity to light. You may have some ringing in your ears.
Right.
So a lot of symptoms that can accompany a concussion. And the important thing is to have it diagnosed. Okay. Now, that requires seeing a physician and then seeking medical attention and often imaging. Now, imaging plays a role in that it determines how serious the brain injury is, whether you've had any bleeding in the brain, whether there's any damage to the neurons, which are your brain cells. And MRI is really good for looking at traumatic brain injury because when you bleed, you release a little bit of blood products in your brain, and the blood products are then kind of metabolized, and you get what's known as hemosiderin. And our 3T magnet is very sensitive for detecting little bits of blood. And so it can detect small amounts of blood in your brain tissue or in the fluid that bathes your brain. So it's really effective in assessing patients who have undergone a closed head injury.
Right. Now, could you feel that? I'm not talking like you would as if you'd received a cut on your arm or anything, but if you're bleeding in your brain as a result of some kind of traumatic event, can you feel it?
You will have symptoms of headache and symptoms that are described above, but concussions, there are also different types of concussions. Okay, they're graded as mild or grade 1, moderate grade 2, and also severe grade 3, depending on loss of consciousness and amnesia. So a grade 1 concussion is that you have symptoms that last for less than 15 minutes, and there's no loss of consciousness.
Right.
Okay. Grade 2 concussion is there's no loss of consciousness, but symptoms last longer than 15 minutes. Okay? In grade 3 concussion, you actually lose consciousness. Okay? But sometimes it's only for a few seconds. Okay? And so there are different grades of concussion, too.
Okay, and I suppose, though, it would depend in some way. If you're in a traffic accident, a traumatic event in which there's, huge forces brought to bear and you just get knocked around like a rag doll, that's one thing. But if you're playing sports, for example, Dr. Yee, and you get bashed in a contact situation and you kind of shake it off and you get back up and, you feel a little woozy for a second, but off you go. But even sports, even kids' sports, have recognized that maybe just shaking it off and getting back into the game isn't the smartest decision made by the player at the moment. And so now they have these concussion protocols. That's at least a good start, isn't it?
Absolutely. Now, unlike other cells in your body, brain tissue does not repair itself. Once you lose a neuron, once it's gone, right? So you want to know after you had your noodle rattled, whether your brain tissue is damaged, because you don't want to accumulate multiple brain injuries throughout your lifetime, particularly if you're a young child or an adolescent, right? So I think it's very important to determine how much of your brain you did injury. During that episode.
I had no idea, Dr. Yee, that the brain has no capacity whatsoever to regenerate injured parts of itself.
No, your central nervous system, once that neuron dies, it's gone.
So all the more pressing reason to want to get in and get as defined an exam as possible to find out exactly what did happen and what damage occurred.
Absolutely. And the 3T magnet, because of its high sensitivity for detecting little bits of blood product with our susceptibility weighted imaging protocols, is really ideal for that situation.
Mm-hmm. We have a program here on the weekends called The Law Show, Dr. Yee, and we speak with a lot of lawyers, and many of whom actually have told us, especially personal injury lawyers, have told us about their high regard for the medical imaging capabilities that you and your colleagues have, because if there's a traffic accident, for example, or a workplace accident in which some blame could be assigned and damages awarded, the more specific you can be about the nature of the injury, the more, the better the case you're going to be able to present.
Absolutely. Imaging with MRI can objectively give you evidence that some bleeding in the brain has occurred and that injury has occurred. And so it's irrefutable evidence.
Is it necessary, Dr. Yee, to have a cathartic event in order to sustain a brain injury? A traffic accident, sure, you would expect some traumatic event or some traumatic consequences, and certainly in contact sports it happens all the time. But could a fall produce a brain injury?
Absolutely. We see that all the time, particularly in elderly patients who are on anticoagulation for either a heart valve or for another reason.
Oh, I see. So again, if there's now we're talking a senior, right? So
yeah.
If a senior sustains a fall, obviously you're going to look for hips and knees and all of that sort of thing. But one shouldn't rule out a brain scan as well when these things occur.
Absolutely. Unfortunately, as you age, your brain cells also kind of die off, and so your brain shrinks a little bit too.
I'm sadly coming to terms with that.
Because of that, the space around your brain or the fluid around your brain, that space kind of increases. So your brain is a structure which kind of floats in this fluid called CSF.
Right.
And when you're older, if you fall down, bang your head, well, there's more space for the brain to rattle around with. And so you're more prone as you get older for tearing blood vessels around your brain, which may lead to collections of blood around the brain. You may hear the term subdural hematoma.
Yes, I've heard that many times.
Or epidural hematoma.
What does that mean? What is a subdural hematoma?
It just means that the collection of blood has accumulated outside the dura, or the dura is one of the linings of the brain.
Okay. So the injury is caused by the brain inside your skull, which is a pretty heavy-duty bone. And it's the brain bashing off the walls inside your head. That's where the injury occurs, right?
That's right. The brain's rattling around, and it tears these little bridging vessels.
And all the more reason for people of advanced years, should they sustain a fall or some other event that involves a bash to the head, maybe an automatic ought to be a little more attention paid to potential brain injury.
Absolutely. The physician seeing you, either your family doctor or the emergency physician or the physician at the urgent care center at False Creek will be alerted from your history and of your symptoms that possible traumatic brain injury has occurred.
Right. Now, you mentioned in the course of describing a senior who took a fall, perhaps that individual, you said, was on some kind of anticoagulant drugs or other heart medication. Certainly for boomers and our senior parents, heart issues are front and center. That could probably be concern number one for most boomers. Would you agree?
Absolutely.
So what can you at False Creek Healthcare do for people who are boomers and beyond who are concerned about health issues?
Well, we perform a test called CCTA, which stands for Coronary Computed Tomography Angiogram.
Okay.
And what this is that it's an imaging test that looks at the arteries that supply your heart with blood. Unlike traditional coronary angiogram, CT angiogram doesn't use a catheter that you have to poke through your groin or through your arm to assess the blood vessels of your heart.
It's non-invasive, right?
Invasive, yeah, exactly.
Okay.
Instead, a CTCA angiogram relies on the CT scanner to produce images of your heart and its blood vessels. It's non-invasive, does not require any recovery time. It is increasingly an option for people with a variety of heart conditions. It does, however, involve the use of contrast, so you have to have a little needle placed in a vein, either in your elbow usually, and the recovering time is minimal.
Well, I was just going to say a little prick with a needle compared to that thing with the in the leg is it's night and day, isn't it, in terms of inconvenience comparisons?
Absolutely, but one should also keep in mind that the CCTA exam should not be used as a screening test in the general population. It's a major new tool in the diagnosis of coronary artery disease, and in patients at high risk for developing coronary disease, such as smokers, those with a genetic risk, or high cholesterol levels, or hypertension or diabetes.
So if someone comes to you and requests a CCTA, Dr. Yi, they've seen other medical types and they've been told, look, you better go have one of these.
Absolutely, it's an excellent next step for the diagnosis of coronary artery disease.
Okay. You mentioned lung disease and lung concerns, certainly among boomers and beyond as well. We need to take a quick break here, but when we come back, we'll focus in on lung scans. Do you do lung scans?
Absolutely.
Okay, well, we'll talk about that and all of the other fine work done by our guest, the medical imaging director at False Creek Healthcare Center in Vancouver. Dr. William Yi is with us on Boomer Life. If you want to have a look at his operation, no pun intended, you might want to check out FalseCreekHealthcare.com and learn about Dr. Yi and the incredible, talented group of medical professionals down at 555 West 8th Avenue. We're back with more on Boomer Life in a couple of minutes here.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.